Worrying is something every single one of us does. Before a job interview, before a big presentation, when someone we love doesn't text back for too long. That kind of worry, it's completely normal. It's your brain doing its job, keeping you on your toes, flagging things that matter. But what happens when the worry doesn't stop? When it shows up for everything, the grocery run, the weather forecast, a conversation you had 3 days ago, and it just won't let go? That's a different experience. And it has a name: generalized anxiety disorder, or GAD. In this video, we're going to walk you through exactly what GAD is, what it feels like from the inside, both mentally and physically, how it's diagnosed, what causes it, and what actually helps. Whether you're wondering about yourself or trying to understand someone in your life, you're in the right place. Generalized anxiety disorder, or GAD, is a mental health condition defined by persistent, excessive worry that's difficult or impossible to control. And we're not talking about worrying before something stressful. We're talking about an ongoing state of intense anxiety about the ordinary stuff of everyday life: work, health, money, relationships, household tasks, often without a clear reason. The key word is generalized. Unlike a specific phobia, which is fear tied to one thing, anxiety like this tends to attach itself to almost everything. One worry resolves and another slides in to take its place. It's less a spike of fear and more like a low hum of dread that never fully shuts off. People living with anxiety often know, on some level, that their worry is disproportionate to the situation. But knowing that doesn't make it easier to stop. The worry feels involuntary, almost compulsive. It can make it hard to concentrate, hard to relax, hard to sleep, and hard to just be present in your own life. Here's something worth knowing right off the bat. You are far from alone. In any given year, generalized anxiety disorder, the most common form of anxiety, affects more than 6.8 million adults in the United States alone. Anxiety disorders overall affect an estimated 40 million American adults. They also show up in children, not just adults. Women are about twice as likely as men to be diagnosed with anxiety disorders. And research suggests that symptoms tend to build gradually, with anxiety more commonly affecting younger and middle-aged adults. Despite how common anxiety is, it's frequently underdiagnosed. A lot of people live with it for years without ever getting a name for what they're experiencing, and therefore without ever getting the help that could actually make a difference. That's a big part of why we're making this video. Knowing what to look for is the first step. The symptoms of GAD fall into two main categories: psychological, meaning what's happening in your mind and emotions, and physical, meaning what your body actually feels. Let's take them one by one. The psychological symptoms of GAD are often what people notice first, because they're so persistent and so hard to shake. Intense and persistent worry. This is the hallmark of GAD. The worry is excessive relative to the actual situation, and it tends to last for months rather than days. Per the DSM-5, the clinical diagnostic manual used by mental health professionals, you're experiencing this symptom if you've been worrying more days than not for at least 6 months. Difficulty controlling the worry. It's not just that you worry a lot, it's that you can't seem to stop even when you try. One anxious thought leads to another, and then another, a chain reaction that can feel exhausting and out of your hands. A constant sense of dread. Many people with GAD describe a background feeling of something bad being about to happen, even when nothing is actually wrong. It's like waiting for the other shoe to drop all the time. Intrusive thoughts. Thoughts about worst-case scenarios can feel like they break in without permission, pulling you into spirals of what-if thinking. Excessive planning and indecisiveness. Some people with GAD Manage anxiety by over-preparing, planning meticulously for events far in the future, or spending huge amounts of time on small decisions out of fear of making the wrong choice. Difficulty concentrating. When your mind is preoccupied with worry, it's hard to stay focused. Many people describe their mind going blank or feeling foggy, especially under pressure. Irritability. This one often surprises people. Anxiety doesn't always look like fear. It can show up as being on edge, short-tempered, or easily frustrated, even in situations that wouldn't normally bother you. Trouble sleeping. Lying awake at night, mind racing, is one of the most common experiences people describe. You might have trouble falling asleep, trouble staying asleep, or wake up already feeling tense. And because poor sleep makes anxiety worse, this can become a trouble sleeping. Lying awake at night, mind racing, is one of the most common experiences people describe. You might have trouble falling asleep, trouble staying asleep, or wake up already feeling tense. And because poor sleep makes anxiety worse, this can become a difficult cycle. Here's something people don't always realize. Anxiety isn't just a mental experience. The body keeps track of it too. Muscle tension and soreness. Chronic anxiety keeps your nervous system in a low-level state of alert, which means your muscles are often braced. You might notice tightness in your neck, shoulders, jaw, or back. Fatigue. Being anxious is tiring. The constant mental activity and physical tension of GAD can leave you feeling drained even when you haven't done much. Restlessness or edginess. A feeling of being unable to sit still, of needing to do something but not knowing what. That physical restlessness is very common with GAD. Headaches. Tension headaches are a frequent companion to chronic anxiety, often linked to that muscle tension we just mentioned. Sweating and hyperventilation. In more acute moments, anxiety can trigger the body's fight or flight response. Sweaty palms, a racing heart, shallow breathing. These physical responses are real and involuntary, not something you're doing on purpose. Taken together, these physical symptoms can sometimes lead people to think there's something wrong with them medically. They might visit their doctor repeatedly for things like headaches or stomach problems, only to find no physical cause. This is one reason GAD often goes unrecognized for a long time. Only a licensed mental health professional can diagnose an anxiety disorder. That's important to say up front. Self-diagnosis isn't the goal here, but understanding what a clinician looks for can help you know whether it's worth making that appointment. The most widely used diagnostic tool is the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. For generalized anxiety disorder specifically, a person needs to experience excessive anxiety and worry about multiple different topics, occurring more days than not, for at least 6 months. The worry also has to be difficult to control and accompanied by at least 3 of the following: restlessness or feeling on edge, fatigue, trouble concentrating, irritability, muscle tension, or sleep disturbance. Clinicians also often use a brief assessment tool called the GAD-7. It's a 7-question screening that measures both the presence and severity of anxiety symptoms. Research has shown it to be a reliable tool across different types of anxiety disorders, and it's commonly used by both therapists and primary care physicians. If you're curious about your own symptoms, Talkspace offers a free online anxiety screening that can help you better understand what you're experiencing before talking to a professional. You can find the link in the description below. The honest answer to what causes anxiety is we don't know the full picture yet. Like most mental health conditions, it's not a single cause. It's a combination of factors that can raise a person's risk. Genetics. Research suggests that anxiety does run in families. If a parent or close relative has been diagnosed with an anxiety disorder, your own risk is higher. That doesn't mean it's inevitable, just that there's a genetic component at play. Personality. People with a temperament that tends towards self-doubt, negativity, and worry, what psychologists call neuroticism, may be more likely to develop an anxiety disorder. If you've always been a worrier, that trait can be a contributing factor. Brain chemistry. Imaging studies of people with anxiety disorders show differences in brain activity, particularly in the emotional centers of the brain. There also appears to be an imbalance of serotonin and other brain chemicals involved in regulating mood. Life experiences. Traumatic events, prolonged stress, or difficult life circumstances can contribute to or trigger anxiety. A substance use challenge can also be a risk factor. Chronic illness. Living with an ongoing health condition can be a significant source of anxiety and can sometimes contribute to the development of an anxiety disorder. It's also worth noting that anxiety often occurs alongside other mental health conditions, particularly depression. This overlap is common, and it's one reason accurate diagnosis matters so much. Treatment works best when it addresses the full picture of what someone is experiencing. Here's the good news. Anxiety is a highly treatable condition. People can and do get meaningfully better with the right support. The goal isn't to eliminate worry from your life. It's to get to a place where anxiety doesn't run the show anymore. Therapy is widely considered the most effective approach for managing anxiety. The type with the strongest evidence base is cognitive behavioral therapy, or CBT. CBT works by helping you recognize the thought patterns that feed your anxiety and develop more balanced, realistic ways of responding to them. Over time, it gives you practical tools you can use on your own. Mindfulness-based approaches and acceptance and commitment therapy, or ACT, have also shown real promise for anxiety, helping people build a different relationship with their anxious thoughts rather than trying to fight them. For some people, medication is part of the treatment plan, either on its own or alongside therapy. A psychiatric provider might recommend an SSRI, like escitalopram or sertraline, or an SNRI, like duloxetine or venlafaxine. Both work on brain chemistry involved in mood and anxiety. These are not sedatives and aren't habit-forming. Any medication decision is made collaboratively with a licensed provider based on your specific symptoms and health history. Alongside professional treatment, there are things you can do in your everyday life that genuinely support mental well-being. Moving your body regularly, even light physical activity can reduce anxiety symptoms over time. Keeping a consistent sleep schedule. Sleep and anxiety have a two-way relationship, so protecting your sleep matters. Reducing G-caffeine, which stimulates the nervous system and can amplify anxious feelings. Journaling, writing down your worries, can help you see them more clearly and feel less controlled by them. And maintaining connections with people you trust. Social support is a genuine buffer against anxiety. None of these replace professional care, but used alongside therapy or treatment, they can make a real difference. If anything in this video resonated with you, that's worth paying attention to. You don't have to have all the answers right now, and you don't have to navigate this on your own. Talkspace connects you with licensed therapists and psychiatric providers who specialize in anxiety. You can match with a therapist within days, and most major insurance plans are accepted, with an average copay of just $10. Whether you're just starting to ask questions or you've been living with anxiety for years, the right support can change things. You deserve to feel and function well. Visit Talkspace.com to sign up for therapy or psychiatry and take the first step today.